My name is Kim. I'm one of the social worker therapists here at the Child and Family Center. And I just thank you all for coming. I know we've actually been waiting a long time to set an appointment. If you can actually all go around and if we can introduce ourselves.
My name is Joe. I'm Kenneth's father.
I'm Jane, her mother.
And I'm Chrissy, Jane's community advocate.
And I'm Donna, the nurse practitioner of the services.
Can you actually just start maybe by telling us a little bit about what brought you in?
I just have a question quick. Why is there a nurse practitioner here? We don't want any medications. You're clear on that.
Oh, I'm just here to observe at this point.
She's actually a nurse practitioner, and what we do here is we actually work side by side with a nurse practitioner. And she just actually sat in today, just as a support and just to see, maybe rule out any treatment options.
Yes. We also want to work on her developmental level and her medical, any rule outs, that would be my area, so, okay?
So if we can just start a little bit by telling us maybe what brought you here.
She had a lot of behavioral problems, such as throwing a chair, kicking other students, or yelling at teachers.
Sorry, can you tell me your name, please?
Her name, Cami.
She's also acting out at home a lot. We have another daughter, Sarah, and she's older, but they don't get along at all. She likes to pick fights with Sarah. She kind of like terrorizes her a lot of times. She'll rip apart her room, and she doesn't really listen to us, and it's bringing a lot of stress on us. And
Well, I can really attest to the stress that they're dealing with. Primarily, I heard about your agency and your alternative interventions, and we were hoping that maybe this particular therapeutic method will be more successful for Tammy.
because we've tried a lot of things, and nothing's really working.
Okay. What kinds of things you've tried?
We've tried traditional settings of cognitive behavioral therapy where she's just sitting with a therapist, but she doesn't talk. She only time she really verbalizes to us is when she's yelling. So it was useless because she just went in the room and she just sat there. And it brought more stress on us trying to get her there because she didn't want to go.
Just a few things. How is she developmentally?
She's reached all of her milestones developmentally. She's 7 years old. She can read, she can write, or she's at her age level, educational-wise, mental-wise, cognitive-wise. But she does have a history of abuse. We adopted her about 6-7 months ago, and she was abused for basically her whole life until we adopted her. We adopted her out of the hospital after she was recovering from a surgery from being physically abused.
If they have any history, medical histories, mental health, or substance abuse, anything of that nature?
We know nothing about her father. Her mother was raped, and that's what Tammy is the product of the rape. She had one other biological sister, and that sister was not abused at all, so Tammy was the target for the mother. Her mother drank a lot. We do know there was substance abuse on the mother's side. She was depressed and, finally.
Now, have you consulted any psychiatrists? Has she ever been put on any medication? You know what I mean? Like developmentally, it seems like she had a really tough childhood, just with the whole abuse history, and even her mom being a product of rape and not knowing who her father is. And it must have been difficult for you too as well. Even having her as well as another child at home can be very, distressing.
She had ADHD and tried medications with her, but they didn't work. They were useless, and we were just feeding her meds that she didn't need. So that's why I'm sorry to be upfront with you.
Okay. And currently, she's not on anything? No. She doesn't take any medications? What changes do you want to see happen with her?
Well, I would like to see her interact with her peers and teachers at school. She can respect them, not being aggressive to them.
Yeah, we we just want her to be happy. She's just not happy. Nothing she does, she's just always angry or upset or something. You know, we try to do everything, you know.
Can you give me an example of maybe a time where she was unhappy? Like, has she been unhappy her whole childhood, or are there times within the childhood that you've seen her excited?
Well, we've only had her for the last 7 months, so she really, you know, the whole time when we brought her home, we had a first, you know, good month outside of us that she really doesn't bond with and talk to. So
I think it's based on the records that we obtained from the adoption agency. It didn't show that Tammy was engaging with other peers. She spent most of her time in the hospital due to the abuses that she received from her mother. Like, record shows that she had numerous of broken hips, fractured limbs and whatnot, and this is where CPS got involved, you know, based on the severity of the abuses. And so after a couple of visits, hospital visits, the mother decided to relinquish her parental rights, and that's where she was placed at an adoption agency, and that's where Jen and I met.
Seems to be very beneficial, successful with many children, mostly traumatized kids, PTSD. And what usually happens is the children can't articulate their emotions into words, so they kind of use the sand play therapy model, which is a box of sand with different kind of figurines and stuff, and they kind of make a picture of, like, they almost internalize their feelings, so that when they play in the sand, they almost are externalizing their feelings without actually knowing that, so that therapists and stuff are able to interpret what they're doing.
Sand play therapy developmentally is very good for a child, 7, anyway, because their ability to verbally express their emotions and feelings, they haven't necessarily developed that range. And you also expressed that your daughter is somewhat nonverbal and she's more aggressive outwardly. So this could be a really good match because, as Kim said, that the box is contained, which gives her a sensation of safety, okay? And she'll come in and see Kim, as she'll say, for a few visits first, so she gets comfortable with her. And then she will have all these figurines to choose from. She gets to put them in the box. She gets to